It's not only when you have full-blown diabetes the big issues are going to happen. That is when you're going to go blind and you're going to get peripheral neuropathy and you might get an ulcer that doesn't heal very well and then you have to get an amputation. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgeries. Today, I want to help you figure out if you or a loved one has prediabetes. Why should everyone be listening to this episode right now? The big reason is 80% of the population is pre-diabetic. So chances are that if you're listening to this episode, you currently have prediabetes. So it's very important. It could cause all kinds of health issues. We need to look into it. Why does prediabetes matter? Is there any issue with it? I mean, it's just the disease before the real bad disease, diabetes, right? So when you're in prediabetes, it's going to be so much easier to take you out of prediabetes and into a good, healthy blood sugar regulation than when you're full-blown diabetic. Also, there are damages that can happen from when you're full-blown diabetic that are irreversible. Like there could be damage to the eyes, to the nervous system, like peripheral neuropathies, even though I have a lot of treatments that can improve these things, but it's so much more difficult to get back to a normal state when you're not. Or let's say you have prediabetes, it causes this smoldering inflammatory response that can increase your risk of other diseases, like cardiovascular disease, like autoimmune disease, possibly cancer, all these bad guys that we don't want, right? So if you keep your blood sugar too high for too long, it's going to cause a big issue. It's not only when you have full-blown diabetes, the big issues are going to happen. That is when you're going to go blind and you're going to get peripheral neuropathy and you might get an ulcer that doesn't heal very well and then you have to get an amputation. That's diabetes. But you could have low-grade diabetes called pre-diabetes that leads to all these other health issues that I just talked about. And then you could also get more sick more often, just like get viruses more often. And your joints can hurt and all these type of things can happen when you have prediabetes. So it's very important to take care of before it becomes full-blown diabetes. Let's talk about the signs and symptoms of prediabetes. So the first one I want to talk about, let's just talk about the labs, right? Those are some signs. So let's say you go into the doctor, you get what's called the CMP, and you see that your fasting blood sugar is just above 100. It's like at 105. That is telling me you're at the very beginning stages of having prediabetes. Another thing that I do see also is people that are pre-diabetic tend to have hypoglycemia. Might sound counterintuitive, but what happens is their body becomes so reactive to sugar, there's a spiking and lowering all the time. And that's a beginning of prediabetes. Your laboratory work might not show prediabetes yet, but it's going to very soon when I see these dysregulations of blood sugar. It's like the very beginning sign that someone is going to be getting prediabetes or even diabetes in the future. Some other tests that I do see that can tend, like let's say you don't get a hemoglobin A1C, which isn't a common test that you get through the doctor. Like basic tests are CMP, CBC type of tests. You might get an inflammatory marker if you go to more detailed testing. So that's a basic one that you see there. But another one you see is a CRP. I see a CRP is a test that we check for inflammation. And even more specifically, one I like is called a highly sensitive CRP, also known as HS-CRP. And this one looks like inflammation around the blood vessel. And we could start seeing that level trickling up when someone is pre-diabetic. And then obviously we're going to see that you have prediabetes through a hemoglobin A1C test. And that's when you have a hemoglobin A1C of 5.7 to 6.4. And that's when we actually make the diagnosis that you're pre-diabetic. Now, let's talk about some of the signs. What are some of the symptoms you actually experience? So you can start getting more thirsty. So with full-blown diabetes, you're thirsty all the time, but this could be a mild thirst. You're just like, I feel like I need a lot more water more often. You also start urinating a little bit more often, or you start urinating a little bit more at night. You're not able to drink water late at night anymore when you used to be able to do that, and now you're waking up more often during the night. You might start to get a little bit of these achy joints, inflamed joints, because that blood sugar is starting to cause an increased inflammatory state. Your brain might not be able to function as well. You're feeling like You're not able to remember things as well. You're not able to focus as long. Your brain might get really tired more quickly. You also, another symptom that can happen is you start getting a little bit more tired, or you get a little bit more exercise intolerance. You don't tend to have as much energy. You don't have as much energy at night like you used to. So these are some of the signs you can experience with someone that has prediabetes. Now, I do want to reiterate, though, that majority of people aren't very in tune with their body and they really don't notice anything's happening at all. Or maybe you are and you really don't notice anything at all, too, because it's not really horrible blood sugar yet. It's like this smoldering issue that's occurring. So you could have some of these symptoms that I just talked about, but you could not even have these symptoms at all, and you definitely still need to get your blood tested to make sure you don't have these chronic health issues in the future because you didn't get your blood tested and checked for prediabetes. How often do I recommend someone get their blood work checked to make sure that they don't slip into prediabetes, or they're able to identify it early on? I recommend that going into the doctor once a year is sufficient. And then if you actually get the diagnosis of prediabetes, I would recommend getting your blood tested every 3 to 6 months. Are there certain groups of people that are at more risk of getting to prediabetes than others? Yes, there are. So people that tend to be more overweight or have more fat on them, they tend to be more at risk of prediabetes. People that tend to have, they've been diagnosed with high blood pressure, they tend to be people that have prediabetes. Those that are more sedentary, that have very sedentary jobs or don't move very much, they tend to be at risk. And then we're going back to the stress thing again, right? Those people that have high stress jobs or stressed all the time or really anxious all the time, they tend to have higher blood sugars and have risk of prediabetes also. Age is definitely an important one. The older you get, the more at risk you are of prediabetes. You definitely need to become more prone to looking at your blood sugar at least after 40, 50, 60, 70. The older you get, the more likely your cells are going to become desensitized to sugar and you're going to start getting prediabetes. So visit my website, integrativemedica.com. Find my phone number there, give my receptionist a call. They can set up an appointment with me virtually or in person. You could also set up a visit directly from my website. If you want to reverse prediabetes or other blood sugar issues, there are a number of things that we need to look into. In another video, I dive into this. Click my video to the right. I put it on the right side. I'm Dr. Jake, and I'll see you there.